Dobar dan, kolegice in kolege. Da prvo rešimo jezik. Jaz sam moja stara generacija, pa pričamo srpsko-hrvatski, naš-armijski. Nadam se, da svi razumemo. Može engleski, ako želite, ali verujem da može tako je. Ovako, drago mi je da ste došli. Samo par formalnih reči. Ja sam Aleš Curk, nadležan za veterinu jugoistočna Evropa u Krki. Sa sobom sam doveo danas stručnjaka za područje painkillera i opće proizvoda za malu praksu. To je Špila koja će vam kasnije izložiti prezentaciju znači preveniranje bolova i terapiju bolova i Robenacoxib kao proizvod. Ali samo za početak par reći oko Krke koju vi svi znate, verujem, sigurno, samo verujem da je tako. Ali i to treba da kažem, obično ja kad dođem na teren, dakle u Zagrebu ja volim da idem do vas, do kolega, jer sam i ja veterinar, pa da pričamo direktno, da slušamo i vaše reči, predloge, iskustva, jer mi proizvodimo, dakle napravimo proizvode i proizvedemo proizvode, ali to napravimo na temelju vaših iskustva i potraživanja i potrebe, kako god se čovjek vidi. Pa zbog toga ja obično volim da čujem i vaše reči, znači obično. Tu je generacija ideja za nas kao proizvođači farmaceutskih lijekova, jer vi ste tu first line front, znači vi ste oni koji radite, vi znate najbolje koja je situacija i koje su vaše, šta vi trebate najbolje. I onda tek mi dođemo kao proizvodna i dobro, kao farmaceutska kuća koja to napravi. Tako da mi je uvijek drago i danas pozivam sve vas. Otvoreno kažite, mi smo tu da slušamo, bilo dobre i bilo je slabe reći, preporuke, kritike, šta god. Tu smo. Ja imam dugogodišnje iskustvo, tako da volim da čujem i loše reći ako treba, nema to problem. Za nas je to isto tako važno. Ako treba nešto da se ispravi, to je za nas isto tako važna stvar kao da se nešto novo pravi. Tako da uvijek dobrodošli, šta god. Dobro, samo za uvod, ja ću samo par reći oko Krke kompanije. Znači, kao znate, Krka je internacionalna kompanija koja radi pre svega humane proizvode i trži, ali unutar toga smo i mi veterinarski odjel koji zapravo je uključen isto tako u takozvani core biznis, znači celokupni biznis Krke. Imamo isto značenje. Manji smo, puno manji od humane farmaceutike, ali bez obzira na to mi imamo isto značenje, isti tretman i isti prioritet. Da ne bi bilo tako, mi nikad ne bi ušli proizvodnju, ali s obzirom da mi kao veterina upotrebljavamo za proizvodnju naših lijekova ista postrojenja kao humana, mi mora da imamo isti prioritet, inače ne bi nikad došli na red. Ali bez obzira na to, s druge strane, mi koristimo ista postrojenja, znači isti kvalitet, iste standarde kao humana farmaceutika. I to nam je, da tako kažem, dobra strana ili jaka strana unutar Krke kompanije. Krka kao tako funkcionira, da tako kažem, cijelim svijetom. Mi smo delamo kao Krka preko, ili servisiramo preko 100 milijuna klijenata, znači bolniki, znači osoba koje trebaju naše lijekove i preko 16 milijuna životinja kao veterinar. Tako da, to smo mi započeli, znači naše aktivnosti već ranije, nakon stvaranja Krke, odmah veterina je krenula isto tako unutar procesa. Danas imamo više mjesta gdje Krka proizvodi svoje proizvode. Dva su mjesta unutar Krke, znači to je jedno novo mjesto koje ima 2 lokacije. Onda imamo sad novo postrojenje blizu Zagreba, u Hrvatskoj. Imamo, znači, proizvodni dio ima Poljska, ima Rusija, ima Njemačka i sad novo par godina je isto tako Kina. To je pre svega za one proizvode koje teško dobijemo i teško proizvodimo tu, tako da postojimo povečali fleksibilnost i mogućnost proizvodne, pa imamo postrojenja zapravo širom naših tržišta, da tako kažem. Veterina ima proizvodnju samo u Sloveniji i Hrvatskoj. Znači, samo Novo Mesto, Slovenija, tamo smo radili od početka do, mislim da ima 4-5 godina, kad mi imamo proizvodnje u Jastrebarskom do Zagreba. Znači, veterina je jako specijalizirana i mi smo ostali, naša proizvodnja ostala tu, da bi mogli što više kontrolirati kvalitet. Prošle godine Krka prvi put probila 2 milijarde prodaje u cijelom svijetu, a veterina unutar toga, znači mi nekako reprezentiramo nekih 6% cjelokupne prodaje. To je zapravo duplo više relativno gledajući od onoga što je nekad do sada bilo. Mi smo uvijek bili negdje 3% unutar cjelokupne Krke, međutim sad smo porasli i naše značenje je poraslo i dupliralo se na 6%. Tako da vidi se da i mi postajemo unutar Krke značajniji kao veterina, naši proizvodi, a rezultat toga je da očekujemo za par godina jako široki plasman novih proizvoda. Znači sve ono što je dan današnji blockbuster, najprodavanije, najbolje u svijetu, to će imati Krka za pregled. Znači, Krka je odlučila da investira u veterinu i rezultat toga će biti, ćete imati zapravo biti unutar tog rezultata i vi u Makedoniji, jer i vi dovedete proizvode. Zapravo vi u Makedoniji imate gotovo sve plasirano ono što postoji u Sloveniji ili Hrvatskoj, znači, a i to jako brzo, ponekad čak i brže od Slovenije, plasirano vrlo brzo. Krka veterina ima više nego 50 godina iskustva s poslovanjem. Od početka je Krka radila uglavnom proizvode za veliku praksu, za farmske sisteme. Međutim, tamo negdje u 50. godinama, kad se započela dakle, Krkina priča, veterina je započela da proizvodi prvo praškove i sve više dakle, oralne solucije i injekcijske solucije, ali čim se pokazalo da na tržištu prevladuje ili počne da nekako generira se potražnja za proizvodima za malu praksu, Krka isto tako ušla taj segment. I tamo u 2010. lansirali smo prvi spot-on proizvod, zvani Fipris, koji ste lansirali, koji jesmo lansirali u Makedoniji. Tako da počinje zapravo i moja priča unutar veterine. Mi smo to lansirali, sjećam se i dan današnji, stavili smo jedan veliki pano, brand na vaš double-decker autobusu koji je vozio skopljene, prema skopljene. I to je biti započela priča male prakse. Evo onda smo prešli na tabletne forme, svi znate Vetpromet, tadašnji prvi je bio još bili su ukusne tablete, danas imamo i bolje formulacije, to je chew formulacija. I oni proizvode koji su u tabletne forme i svi dan današnji koji jesu već novi, koji će još biti novi, to je sve chew formulacija. I Krka razvija tu priču. Skoro lansiramo i novi proizvod u pipetnoj formi, to je DehiSpot, koji bi zapravo već trebalo da dođe tu, ali za par dana, da tako kažem, on će biti lansiran, DehiSpot. Što se tiče tableta, mi imamo nekako iskustvo 20 godina. Razvoj i prodajam tableta, prva je bila normalno NSAID tablete, su bile koje su predstavljale neki logični produžetak razvoja NSAID proizvoda za veliku praksu. Međutim, kad smo mi normalno počeli da se bavimo malom praksom, tada smo prvo mislim da su bili tablete, vaše NSAID tablete za malu praksu. I dan današnji imamo cijelu paletu više najznačajnijih proizvoda u tabletnoj formi, uključujući i tablete protiv bola, znači o kojim ćemo danas šire malo šire, malo popričati vezano za to. KRKA kao KRKA normalno gleda da ne samo da razvije i da proizvode visokog kvaliteta, znači ono što je njezin standard, nego da i distribuira te proizvode do krajnjeg kupca, potrošača, standardima koje osiguravaju taj kvalitet koji KRKA drži. I u tom smislu treba da ima ne samo dobar razvoj, dobru proizvodnju, već i dobru distribuciju. Znači tu imamo sreću da u Makedoniji da smo nekako sklopili saradnje, da radimo dugo godina sa firmom Vetpromet, da smo sada i koji ima sada jako dobro celokupno postrojenje distribucije od magazina pa do kombija i znači vozila koje sve biti podržavaju toj takozvani cold ili hladni lanac, čim na taj način državamo dobro taj kvalitet proizvoda do krajnjeg kupca. Ja bi samo toliko za uvod, vezano za KRKA, sve ostalo već vi znate, vezano za KRKA, vezano za te nove proizvode, to ću vam špera pokazati. Hvala.
Okay, I'm a bit younger generation, so I will speak in English, okay? Better because, Slovenian probably will not be understood well, so I will speak in English if you allow me. And we have Nicola, so yeah. It's okay, like we promised, today's session will be about pain, yeah? So first let me introduce myself. I'm Špila Stričnik. This is my dog Alfie. So I'm a big dog person. So I have also personal experience with pet. I'm a veterinarian by profession. I have diploma for quite some years now. Too long. I'm in KRKA since 2017. And my role in KRKA is medical advisor, so any tough questions that Nicola could not manage, I'm sure that there are very little of them, it comes to me, so I'm there waiting for your tough questions. So what is driving me? Basically, I'm very curious, I'm constantly searching for new articles, for new dogmas, for new knowledge. And my area of interest for sure is pain and antiparasitics and parasites, because this is the big portfolio of ours, the biggest one. Okay, so the agenda for today, I divided in 3 chapters. First, I want to start with pain recognition, because even though pain is something I'm sure you all deal on everyday basis, we still unfortunately often miss it, or maybe we underestimate it a bit. We will look at why that happens and what we could do a bit better in practice. So then we will move into treatment. How to choose our option, that you will be more confident using non-steroidals, because there are some grand rules also for non-steroidal usage, and maybe we will share a bit words where non-steroidal fit into your daily practice and your daily decision making. And finally, of course, we will discuss a bit also Robenacoxib, because Robenacoxib, in my opinion, is not just another non-steroidal, because there are quite some big differences among more traditional options like meloxicam, like caprofane, and definitely the differences are of clinical importance. So it is very important also to choose the right patients for which one of the options you might have on the market. So yeah, by the end, my goal is maybe you will find some new solutions how to recognize pain more earlier or maybe more often, that you will treat pain more confidently and maybe have a clear idea when, how to use Robenacoxib in your daily practice. So this is my older dog, I have two of them. This is Don, 12 years old dog, already on Robenacoxib, you can imagine why. But now with the Robenacoxib, he's young again, so I saw that Robenacoxib is working in practice, so that's why I have easier job to share the message, because I saw the results. So what is with this pain? Pain for sure is common. I'm sure that you are dealing with pain on a daily basis. But what is also true about pain, that pain is subtle. It's easily missed and unfortunately underestimated, but not from you, mostly from the pet owners. And without recognition, you will not have a patient, you will not have anything to treat. So that's why the first step in pain treatment is not to have medicine, but to have a patient, to have recognition of pain. And according to literature, that's one of the big problems in the whole pain portfolio, pain treatment. So, truth be told, pain really isn't something that is rare, that is occasional, that is specialistic field. It's something that every clinic will encounter on a daily basis. This is the article from United Kingdom when they researched more than 12,000 cases on 1 year basis, and they wanted to detect the most common conditions that they are treating on a daily basis. And those are the ones, and if you look at them, you can see that basically majority of them are painful. So pain is not like some exotic thing. So on the previous slide we saw that many everyday primary care conditions are likely to be painful. So the next question for you, for me, is how many of these painful conditions are recognized? How many of them are treated properly? Because, yeah, in my opinion, pain detection can be lost in 3 stages. First, at home, this is the crucial stage. At home, I meant pet owners, because, yeah, maybe they detect that animal is acting weird, but he is not or she is not capable of recognizing that this is actually a painful condition. And the hard thing is that, okay, my animal is acting weird. If this pet owner will come to the hospital, yes, then we have a high possibility of detecting, of treating, but many of them are not going to the hospital just because of, I don't know, my dog is irritable, suddenly very aggressive. I found one very good article saying that probably 1/3 of aggressive cases are connected to pain. So even I probably would think another way, not just that, okay, it would be painful, suddenly aggressive dog, but yeah, pet owner for sure will not think about pain when animal will be acting a bit strange, a bit different, will slow down on the walks, hard to jump into the car and something like that. They are just thought, okay, it's a senior pet, he's getting old, he's slowing down, the same with me. It's nothing wrong with this activity. So yeah, the second one is the patient. Our patients are not vocal, okay, they are, but they will not told you I'm in pain. So this is one of the hardest things you have to deal with. It's quite similar with the small children. They are also not capable of telling us. And nonetheless, in the consultation room, you do not have enough time to detect. You are dealing with definitive diagnosis. Maybe sometimes you forgot also the pain component of the whole problem. For example, with otitis externa, this is one of most common, very painful condition. You are just focusing on what is causing this otitis externa, but pain is like a very huge part of this whole thing. Yeah. So this is also some very interesting data that I could find in one recent article. It's about cat owners, because cats are even bigger problem with pain detection. So they asked basically very beautiful number of cat owners, are they capable of detecting cat behavior, that is, the cat is acting strange? And they said yes. But when they ask them if you are capable of detecting that your cat is in pain, you see how low the number is for this question. So it is like very big gap between behavior detection, strange behavior detection, and pain detection. And that is for sure something that could be improved by us as pharmaceutical providers, by you, and nonetheless by Nicola. For sure, pet owners are the group that we need to address more often, because they will come to your offices then. Yeah, like I said, there are, in my opinion, several soft ways how to improve recognition on the owner side. There are now many available on the internet pre-visit questionnaires that can focus attention. Okay, my pet is acting weird, I will just answer this simple couple of questions, and in the articles there is proof that these questionnaires are improving pain recognition among pet owners. So that for sure is a very good idea. Then many osteoarthritis cases are recommended to be using home videos, because pet will act naturally at home. I'm sure there are many pets who are not happy to come to you, so they are not acting like naturally. They are afraid, they will freeze, they will not show you like painful behavior, because there is in their nature that they need to hide it. So for sure it is good to basically recommend pet owners that they film it when the animal is jumping into the car, going up to the stairs, maybe running, how the animal is behaving after a long walk and so on, because those are for sure moments where pain will be present and also seen. Also, when you will ask pet owner that will come to your offices, to your clinics, it's not a question for them, is your pet in pain, but you need to have different questions. Maybe what is different in last half of the year? Is your pet slowing down? Maybe is he or she having trouble urinating, defecating? Those are all moments where animals are showing us that they are in pain. And nonetheless, there is for sure something that currently in KRKA we are paying a lot of attention to. We're providing simple educational materials, also for the pet owners. to explain them behavior that should be connected to pain and the behavior that should be the sign that they need to visit you to deal with pain condition. Okay, so what about in your clinics? What can be done differently, maybe better? Just small improvements that could help you recognize more painful behaviors. Basically, you should implement pain detection in your everyday work. So with the case, okay, beside the diagnosis, you should also try to detect if maybe this animal is in pain. Any change in mobility, any change in daily habits, any change in sleeping behavior, that is also quite common signs of pain, any change in appetite, sleeping arrangements, also senior dogs in pain are having trouble sleeping, so this is like also very common behavior. Any change in temperament, if you remember, 1/3 of suddenly aggressive animals could be in pain. One article is stating even higher numbers. One advice that is also quite present in article is that you observe animal before any touches. When animal is quite confident, because when you start giving clinical exam, animal will freeze, yeah? So it is good that you first discuss with the owners and just with the one eye you are looking at the animal, what animal is doing, how is behaving, how is communicating with the pet owner. Then, I don't know if you already use it, there are now many pain scales available, and some of them are quite good and simple, I must admit. And according to literature and what I was discussing with our professor on veterinary faculty, especially for cats, the pain recognition is better by using these pain scales. Are you using pain scales already? Yeah? Good. Because it's quite different from market to market. In Slovenia, I must admit, there is still quite big percentage of veterinarians that are not using it. Also, when I was in college, they did not teach us about pain scales, so I hope that now in Ljubljana's faculty, this is also part of pain discussion. Okay? So, okay, if now we have pain, my patient is painful, why we want to treat pain in the first place? There is a couple of reasons, very important one. First of all, to conclude, untreated pain can affect the whole patient, not just this painful area, because by recognizing and treating this painful behavior, veterinarians, so you will support recovery, of course will improve welfare, and owners will also be more prone to return to you because they will be happy if the pet will be happy. So those are very, very important things that are going on when the pain is not treated. So immunosuppression is causing longer recovery, or they will not recover at all. Reduced mobility and activity, for sure something that even pet owners will notice. After the surgery, if pain is not addressed okay, you will have impaired healing and longer recovery. Then I think this point is very important. If you will not treat acute pain appropriately, it will develop into chronic pain. And chronic pain, truth be told, is like pain in the ass pain, because it's not just inflammatory component that is present with the pain. You will get now also neuropathic pain that should be addressed with different drugs, so it's very hard to treat. Nonetheless, increased morbidity is also something connected with untreated pain. and yeah, at the last, negative impact on animal, on welfare, on quality of life. This is taken from American guidelines for pain treatment, just to show you that yeah, we have a lot of options to treat pain, to address pain. As you can see, they are recommending for pain to be treated multimodally. So you include several different drugs into the pain treatment. And what I need to emphasize, of course, because we will talk about Robenacoxib later on, as you can see, non-steroidal, non-steroidal, non-steroidal. Non-steroidals are like crucial part of each treatment protocol. Just you need to forget about non-steroidal when you have trauma patient. Non-steroidal is not option for that cases because you do not know what caused the pain, what is wrong with the animal, what condition is the animal having. You also have unstabilized patients, so this is the only example when non-steroidal are not like the first option. When you stabilize this patient, then yes, of course you can continue also with the non-steroidal, but for the first thing, opioids. But you can see for chronic pain and for acute pain of known cause, for example, perioperative, so surgery, for sure non-steroidal are crucial. Where do non-steroidals fit into pain management? All guidelines available recommended for the perioperative pain and chronic pain. Particularly when the inflammation is involved. There is no surgery without inflammation, so around every surgery, non-steroidals are a crucial part because they have one unique feature that none of the others having. They act also anti-inflammatory. Opioids, they are not addressing anti-inflammatory component. And what I am getting a lot of questions also from the field is Robenacoxib acting also like antipyretic? Yes, all non-steroidals are acting on three components: pain, anti-inflammatory, and antipyretic. What is also mentioned a lot from my colleagues, can I use Robenacoxib like in multimodal approach? Of course. Non-steroidals are like crucial part of any multimodal protocol. So those are common conditions that include inflammatory component, and I'm sure that many of these conditions like you see on everyday basis. For example, in my opinion, probably the most common one, basically I did not see any older cat or also older dog with periodontal disease, so dental disease is like one of the most common ones. Nonetheless, in cats, injuries and trauma, urinary tract conditions, also cats, osteoarthritis. You cannot imagine that cats are even higher in this part, but still very undetected. Otitis externa, for sure, something that you see on an everyday basis, and also cancer. Truth be told, according to literature, 1/3 of dogs and cats who basically go out of this world are due to cancer, so very common condition. And with the cancer, the thing is, okay, maybe pet owner will not decide to treat it with chemotherapeutics. At least you can do to prescribe him pain medication. Of course, there are some limitations also with the usage of non-steroidals that we should be aware of. This is also taken from one very good article from Cat Care Association. So basically, what are absolute contraindications? So I will not decide to prescribe non-steroidal. In my opinion, liver dysfunction or failure, because all non-steroidals are metabolized in the liver. So this is for sure a no for non-steroidal. Then of course hypovolemia, dehydration, hypotension, and pay attention, advanced kidney disease, just advanced one, not the starter phases. Then if you have it on some drugs that are basically nephrotoxic, so these are not good combination with non-steroidals. Corticosteroids and non-steroidals, they are not friends, so you cannot use it together, because for sure you will have gastrointestinal adverse events. And of course, if you have clinical signs that are indicated that you have some problems with gastrointestinal system already. Where the non-steroidals are not like prohibited, and you can use it, but be cautious, is the yellow part. So with the super senior cats, there is very high probability of chronic kidney disease. So Robenacoxib and also meloxicam are active ingredients that could be used, but you will need to check blood firstly, and you need to arrange this animal to come back to you to rechecks to see the blood parameters. So this is not contraindication. This is quite different when I was on college, because they teach us back then that chronic kidney disease is something that will prohibit you to use non-steroidal. That's not a thing anymore. And that's why Robenacoxib has its big position here. That was quite common question when I was on some other markets. Can I use Robenacoxib on the patient with gastrointestinal disease? Yes, that is not complete contraindication, just if mucosa is intact. So with ulcers, no, it's a no. But if you have some mild enteritis, yes, it's a yes. Just be paying attention to educate pet owners what are the signs when the non-steroidal should stop. Then there was also studies being made with AC inhibitors, so drugs that will lower blood pressure, or the drugs that are used for cardiac cases for dogs. Can I use it together with non-steroidals? Yes, Robenacoxib has studies to prove that co-usage is okay, but yet again, be cautious. And with diuretics, the same thing. So yeah, that is basically it. So those are the most common side effects that are written all over the literature. What is good about these adverse events? They are not fatal. They will last for 1 week max, and they are not something that animal will be dead because of it. Yeah. Also, quite common question: will I have any problem if I will be used Robexera with platelet aggregation? No, they tested. They also overdosed it, and Robexera, Robenacoxib, did not cause any problem. Hepatotoxicity, you will find it in literature, but not currently with Robenacoxib. You will find it with carprofen. They try to find connection, so is carprofen the one to blame? But the connection was not confirmed. Basically, for dead dogs that have these cases, basically genetic disorder were present. So you cannot connect it, basically. They are constantly, after each clinical study that you are performing, you should also paying attention to adverse events. So every study being made is also detecting the incidence of adverse events. So still the number of those events is still low, despite non-steroidals like usage is like, yeah, big one. This is also taken from one article for the cats. So, which combination of drugs, of commonly used drugs, can be made on cats? I will just point out that, yeah, those two are like completely contraindicated. You cannot combine it with glucocorticoids, corticosteroids, and other non-steroidals. It is also not okay if you are giving, for example, after the surgery, meloxicam, and then you will prescribe Robenacoxib tablets. This is not the practice that is okay, that is safe. And unfortunately, it's not something unusual to be made. So, if you will decide to prescribe non-steroidal for a longer period, it is for sure good to have some patient history, to of course do physical examination, and to do a little bit of laboratory testing, at least hematocrit, to detect if animal is hydrated okay. Because hydration probably is the biggest problem with usage of non-steroidals, because the incidence of kidney incidence will be bigger if you will not detect the hydration properly. But otherwise, yeah, just keep in mind that if you will decide for longer period of treatment, try to invite pet owner to rechecks. I know that it is easier said than done, yeah, but try to implement this, because for pet for sure will be good, because you will try to detect if pet owner is using non-steroidal. That is also something quite problematic with pet owners, and nonetheless you will also detect if pet is responding to the therapy and if blood parameters are still okay. Especially with the cats, because with the chronic kidney disease we know that sometimes the appetite is not okay, so the hydration is highly possible. That is something that should be part of discussion with the pet owner when you will prescribe non-steroidals. So those are the warning signs that pet owners need to be educated about, because those are the signs when the non-steroidal therapy is not working as it should be. So you need to do something about it. First step is for sure that you stop non-steroidal, that pet is coming to the clinic, you will check it, you will assess it, and you will implement supportive therapy. What is supportive therapy? Fluid therapy, then gastroprotectant, and yes, you will continue with painkillers, but not with non-steroids. This is also a constant question that I got from my colleagues on the field. What is the washout period that I need to respect? Some will say 1 day, some will say 2 weeks, some will say 1 week. Unfortunately, there is no consensus how long should washout period be. But in my opinion, washout period of 1 day is not enough, especially if you are replacing meloxicam with Robenacoxib, because with meloxicam you have half-life of 24 hours, so very long. And for sure, after 1 day, meloxicam is still in the system. So, washout period of 1 day, it is not enough, because you will have in the same time 2 drugs in the system, and I can guarantee that the incidence of adverse event will be higher in such patient. Yeah, like I said, this was the question also from one colleague. Okay, I will stop non-steroidal, but what I should do, because this pet is still in pain? Okay, just continue with one alternative. For example, in United Kingdom, paracetamol is very popular in dogs, for sure in dogs. Don't use it on cats. In cats, they are using opioids. Gabapentin is also very popular in Western Europe. So they are using drugs from different groups of medicines. So the next question that I got is, okay, I stop it, so I shouldn't use it anymore. No, that's not the case. You can use different non-steroidal in this patient. You just need to respect washout period. So I would advise you 7 days, but if you diagnose ulcers, then 2 weeks. Yeah. Okay. We are also having some problems. I detected it. Articles detected it with non-steroidal usage in practice. First and very common one is that treatment duration is too short, especially after surgery. I will show you next slide where there is studies being made after performing sterilization or castration. The duration of therapy most commonly is just 1 day, so it's not long enough. Also, I read one article on how long the treatment after massive tooth extraction was in the cats, 3 days. Also, not long enough. That animal is still in pain, so we need to prolong it. Also, common discussion with colleagues from Croatia was how long I need to prescribe it for osteoarthritis, for example, and their average prescription period is 10 days. It's not long enough because you can imagine that osteoarthritis did not appear in 1 day, so it is chronic process, so you need also longer time that animal will respond to the state that was produced after a long period of time. So basically there are very good guidelines for osteoarthritis in dogs, and basically the first clinical examination to detect that therapy was successful is 3 weeks. So 10 days for sure not enough. Then yeah, it's common, but I think the problem is lower and lower. Part of veterinarians are afraid to use non-steroidals on cats because of chronic kidney disease and so on, but now you have 2 very good options also for those kind of cats. One, of course, is Robenacoxib. Then this was one of my toughest questions in latest period. We got some objections about the Robexera. The Robexera is not working, so we detected what is going on, and the solution was you have very different type of pain. You have also neuropathic pain, you have mixed pain, you have cancer pain. So if I remind you, non-steroidals will be covering inflammatory component, not neuropathic. So if neuropathic type of pain is present, you should do multimodal. Of course, you should use non-steroidal, but you should add additional options to the therapy. Then, of course, that is something that could be improved. Don't be afraid to use it. Then rechecks, again, easier said than done, but very good to implement them for several reasons. Then expectations. Many pet owners are expecting that after 1 pill everything will be solved. For sure, that is for sure topic that could be discussed more with the pet owners, so they will have realistic expectations. Then you already told me that you know the validated pain scales. For sure, I would advise it to be using them more often. And nonetheless, always assume that pet owner will not understand part of this therapy, so try to have good communication with the pet owners. What he will treat with the tablet, how to do the therapy, if he is capable of giving the tablet. It is also something that could be discussed more, because many pet owners are having problems with the tablet, so it is good that you demonstrate how to apply a tablet. It's not like science fiction, especially in the dogs, so try to ask them if they are capable of doing it. For sure the success of therapy will be higher. Yeah, that's the slide that I promised you. Basically what is going on with the pain relief, the duration of treatment, it's too short. So especially sterilization, castration, that's for sure is something that you are doing on an everyday basis. Answer to yourself, are you prescribing just one time? Probably yes. In Slovenia this is like common example. You just apply one injection after the surgery, so that's not enough. World Animal Organization is recommending that you implement 3-day therapy after sterilization, so think about to prolong it a bit more. Yeah. Okay. So that's the last part. Nicola, I propose that we have a short break, if you agree.
Okay.
Yeah, because I hope that you are not sleeping, that I'm interesting enough, but yeah, anyhow, I think that short break will benefit you enough. If we must, yeah, okay. So yeah, now we recognize pain, now we know what our options are, and now which non-steroidal we will choose, yeah? You have very different patients, old ones, young ones, cats, dogs, some with other conditions like kidney disease and so on. So decision is not like black and white, so what to do? This is also something that was detected from veterinarians. One article, they asked veterinarians what is the most important feature of non-steroidal, what is the deciding factor, why you decide for this and this and this non-steroidal. So this is the result, yeah. 3, so purple is the most important feature. Green is okay, it is important, and blue, it's not important. Yeah. So as we can see, efficacy was the most important feature. Yeah. Then availability of injectable formulation, the one that Rachel already mentioned. Yeah, that was also a quite important feature. Then yeah, on some markets, very important is what is registered. Then safety, yeah, you can see very important feature. That's why Robenacoxib is such attractive product, because in this safety feature we have a lot to discuss, yeah. Then the ease of continuing therapy, to put in different words, that simple, that you have option of injection and then you can prolong therapy to home environment, yeah. And in my opinion, what was really quite surprising for me, cost was not something that was very big decision factor here. So it's quite different when they ask for antiparasitics. Answers were different, so pain is different. So I really like the result of this. Yeah. So I found another article, what are the desirable characteristics of non-steroidal. COX-2 selectivity, so COXIBs. then that action is targeted so that you are not treating the whole body because no need for that. Then simple and precise administration, for sure. In my opinion, this is very important feature because you are dealing with a lot of different products, and if the treatment protocol is quite hard to remember, it's not very attractive drug to be used. Yeah. Then this is important for pet owners if they will be capable of applying a tablet. Yeah. Then this for sure is good for you. The wide therapeutic margin, so this is safety feature. Then strong and reliable evidence of efficacy. For sure, you want the drug is working properly. Yeah. Then feature was also that provide effective acute and peri-operative pain control, and that is also a possibility of long-term pain control. So we will see which of these features is also feature of Robenacoxib. Yeah. So non-steroidals, there are a couple of options available. So question is, are they all the same? So for sure not. Yeah, they are in the same class, but there are quite some differences among them. First of all, COX-2 selectivity. We have now a new generation of non-steroidals, so meloxicam and carprofen are older ones, so they are preferential non-steroidals. And then we have the youngest group of non-steroidals, those are COXIBs, and Robenacoxib is part of this COXIB group. Then Tmax is time that tells us how fast the drug is eliminated from the blood, not from the whole system, from the blood. Why this is important? This, in my opinion, is safety feature because long time in the blood means simply that this drug is circulating also around the organs, through the organs that are completely healthy. So basically, there is not a place for drug to be there because it's really no need to be there. So Tmax, in my opinion, very important feature. Area under the curve is just one data from summary of product characteristic and is telling us systemic exposure of these drugs. So if the number is low, meaning that the drug is working more precisely, just on the pain point where the problem actually is. Tissue distribution, also something that is written in the SMPC, also important. It is also safety data because it tells us how drug is distributed around the body. If the distribution is extensive, that simply means that drug is also present in the part of the body where you actually do not have any problem. Yeah? You don't need them there. Yeah? Half-life, similar with Tmax. Yeah? Shorter there is, better is. Yeah? We will see in the Robenacoxib. Then formulation and dosing. I discussed with Nicola which drugs are present on your market. Yeah, there are quite some examples of COXIB already available, and truth be told, the only COXIB available on the market is Robenacoxib, available in two formulations, injectable and tablets. None of the other Robenacoxib is not present in injectable formulation. In my opinion, not okay, because the majority of you probably want to start therapy with injection and then continue with the tablet or formulation. So, quite important feature and big distinctive factor among available options. And species-specific profile. This is the last feature is especially important because of cats. Cats are known for their very delicate metabolism when it comes to pain medicines. I'm sure you all know that carprofen is metabolized more slowly in cats, so you should be careful when you use carprofen. So it is completely different with Robenacoxib, where metabolism is not problematic. Drug is metabolized fast, so there is no need to be worried around safety for this method. Yeah. Okay. So if you go to Robenacoxib, what are differences from other available options? What are quite unique features? First of all, it's targeted action. I will tell you more about on next slide. So targeted action is just meaning that Robenacoxib is present where the problem is, and where you do not have a problem, Robenacoxib is not present, which for me is probably one of the most attractive features of Robenacoxib. Okay, COX-2 selectivity, I already told you, Robenacoxib is coxib, so high COX-2 selectivity, especially important when you are using non-steroidal for a longer period of time. Then shortest elimination half-life, so yet again this is the feature telling us how fast the drug will go out of the blood. And Robenacoxib is like champignon in this feature. Especially important, they tested Robenacoxib and they reapplied it after a long period of time. In my opinion, very important, the result was that there is no accumulation in the body, which is good because if accumulation is happening, you can expect after a longer period of usage some toxic effects, but it's not the case with Robenacoxib. Then, of course, something for pet owners, they want to see results fast. So with Robenacoxib, you also have rapid COX-2 inhibition, so you will see results fast. It's the fastest on the market among non-steroidals. Then very attractive for perioperative use. There is also proof when you apply Robenacoxib 30 minutes before the induction. During the induction, 30 minutes before first incision. So before surgery, there is less need for inhalation anesthetics because pain control is already established. So you will use less amount of inhalation, which is, I think, very attractive because I know that inhalation is quite expensive. Yeah. This is also one very interesting study. They apply Robenacoxib to many different dog breeds because they want to detect if there is any individual differences between efficacy, for example, on German Shepherd or on Chihuahua. So they collected quite a beautiful number of different dog breeds, and the result was super because there were no differences. No matter Chihuahua, no matter German Shepherd, they all behaved the same. The efficacy was the same across all different breeds. Why they try this? Because there are some molecules on the market that are having problem with this. So I don't know, Nicola told me that Cimicoxib is not present on your market. So Cimicoxib, for example, is one also possibility in the coxib group. Cimalgex is called. So for Cimalgex there is quite a problem because the efficacy is different across breeds, which is for sure not something that you would want to have in your daily basis because pet owner will not be happy. Yeah? Because For some dog breeds, the efficacy was super. The pharmacokinetic was even better than usual, but unfortunately for some dog breeds, efficacy was not good enough. Yeah? Then wide therapeutic margin, for sure, good safety feature. That's the case if you would overdose it. Robenacoxib has a really wide window, so nothing would happen. Not that we will recommend to overdose it, but if this would happen, there will not be bigger problems. Then, of course, a very attractive feature. Robenacoxib is available in 2 different formulations. Like Aleš said, you will have it soon on the market, also injectable formulation. And what is very attractive, and Robenacoxib is the only molecule with this proof. Those 2 different formulations allowing interchangeable use. What does it mean? Interchangeable means that, for example, I will just give you a plastic example. You start with the injectable, okay, yeah. Then you leave this dog to home environment with a tablet. Then pet owner came back, oh, I cannot apply a tablet, okay, no problem, and you can reapply injection again. So you can switch between those 2 formulations, which is the only molecule that is having this feature. Nonetheless, I'm sure you are having a lot of problems with cat options, because for cats we really do not have many options, so Robenacoxib is good for that matter, another option for you. And this is also something very attractive, in my opinion, for senior cats, because Robenacoxib can be safely used also in cats with stable chronic kidney disease. And nonetheless, simple dosing, yeah. Like I promised, first very important feature, the most important one that also differentiated from Meloxicam, for example, is selectivity. Meaning that Robenacoxib will act only where the problem is, not other parts of the body, because simply you do not need that, because there is not any problem there. So inflammation occurs in joints, surgical sites, injured tissues, Robenacoxib will be there. What is also very important and very common question for me, okay, how come if Robenacoxib is present in the blood for a very short period of time, how come the activity is for 24 hours? It's just because of targeted delivery. Yes, Robenacoxib will go out of the blood, but it will collect in inflamed part of the body. In the inflamed part of the body, Robenacoxib is present for 24 hours at least. Yeah? And because Robenacoxib is not present in the blood for a longer period of time, you have minimized systemic effects. Why this is so important, especially for senior pets? Because for sure that pet is having problems with other functions, with kidneys, for example. So Robenacoxib will not be present there. So this is comparison of COX-2 selectivity, just to show you why Robenacoxib is coxib, so high COX-2 selective, and why Meloxicam is in different group of medicine. It is COX-2 preferential. And you can see, here is explanation, but you can see at the therapeutic dosages how many COX-1 is inhibited by Meloxicam and how many COX-1 is inhibited by Robenacoxib. COX-1 is something that you do not want to block. because COX-1 is important for homeostasis of the body. So by blockage of COX-1, there is higher possibility of adverse events, especially if you are using this drug on longer periods of time. I told you already about elimination half-life, so for how many times this active ingredient, this medicine is present in the blood, and this is comparison with different coxibs. Those are all coxibs that are registered around Europe, so you can see that Robenacoxib is the shortest one here, the quickest from the blood. Why this feature is attractive, in my opinion, for this more sensitive population, very important feature. Also, if you are having some adverse events, let's face it, they are possible. You will get quicker recovery after Robenacoxib because it will fastly go out of the blood. Then, if it is not possible present in the blood, you can expect less interactions with other drugs that are already in the system. For sure, something very important for older patients where you have one therapy already established. Then, I already told you minimal accumulation and Robenacoxib non-accumulation and low systemic exposure. This is also a safety feature. Then COX-2 inhibition is the feature that is telling you how fastly you will see some results. So how fastly inflammation will be blocked and also the pain will be managed. And you already see again comparison with the other coxib. You for sure know meloxicam, so yet again Robenacoxib is the faster in this comparison. Why this is good? Why this is attractive? Why this is useful? Maybe if you are applying non-steroidal perioperatively, so if you decide that you will apply it before the surgery, that is for sure indication that is telling you that when you will do the first incision, some pain management will be already established. So when you will do the incision, Robenacoxib will already be doing her job. This is important, in my opinion, for pet owners. They are expecting fast results. So with the short, with the quick Tmax, is meaning that the results will be seen more fastly. And of course, again, for the pet owner, they will quickly be satisfied because patient will be quickly improving in mobility. They will see in person quick results. Dog will go on to the walk, for example. Okay. Okay. This is question that I am getting a lot of time. How come if Robenacoxib is present in the blood for, I don't know, 2 hours, how come the Robenacoxib is working for 24 hours? So this is the Robenacoxib, the Robenacoxib that is in the inflammation part. How many Robenacoxib is present, for example, in the inflamed tissue? You can see, when the dosage is dropping. But after 24 hours, yes, it is present. Not in the blood, but in the inflamed tissue, it is present. This is one graph that is showing you how fast Robenacoxib is reaching peak. So the highest volume, in the blood. That's just the proof that Robenacoxib is acting fast. also Robenacoxib, if Robenacoxib is causing any clotting problems, any cardiovascular side effects, because these problems did appear in human field, in human with coxibs. There was some cardiovascular problems, and some of the coxib for human use, they were removed from the market. So basically, of course, they were wondering if Robenacoxib has some similar problems, but currently there is no indication for such worry in Robenacoxib. They also tested it, they overdosed it a lot, like 5 times, 10 times, so also very attractive feature. Basically, there was none of problems to be proven. We can here compare it with meloxicam, because meloxicam therapeutic field, say therapeutic features are narrow, so be very careful with the dosing of meloxicam, because meloxicam has not proven such features. They were having problems with kidneys when they overdose it, so for sure not something that is attractive for cats. Also some question from United Kingdom, I think. Can I use Robenacoxib in patients with liver problems? Yes, you can use it, but it depends what the diagnosis is. If you have complete liver failure, no, you cannot use it. If you have slightly elevated liver enzymes, yes, you can use it. The only advice that was written around the literature, that you apply lower dose. Yeah, that's the only thing. But it's not complete contraindication, despite the fact that Robenacoxib is metabolized in liver. So I think quite attractive feature also. For osteoarthritis, when you will decide for long-term treatment, for sure, Robenacoxib has the best safety features when you are using Robenacoxib long-term. For sure, the molecule to choose when you decide for chronic non-steroidal therapy, especially for cats. That is something that is coming to your market. I already mentioned Robenacoxib is molecule available in 2 formulations, so injectable and oral formulation. For sure something that you need, because you will implement therapy in clinic, and then you can continue therapy with tablets at home. I already mentioned today that applying, for example, injectable meloxicam and continuing with different non-steroidal is not like prudent, is not very good practice. I will discourage you to such practice. So by having both formulations, you can help animal on the same medicine, which is the best safety feature. You already know tablets, we have flavored tablets, we have mint flavor and additional yeast flavor, so 2 flavoring agents. The tablet is registered as chewable, which is different from film-coated tablet. What is the difference? Basically, film-coated tablets are not prepared in such a way that animal basically can chew it. You need to hold down the tablet, When the tablet is registered as chewable, it is prepared in such a way that animal can chew it, So when you will giving advice to pet owner, there is no need that they are pushing down tablet, This tablet can be chewed. It is prepared in such a way. We have also perforated blisters. I think for administration it is very good, yeah, very practical. And those are limitations, or maybe, yeah, something that you should have in mind. We have a limitation of 3 months and 2.5 kilos. Important when you are performing castration sterilization, yeah. What is also true, we have this in the SMPC, that tablet will work best if you will apply it on empty stomach. But the catch is that if you will apply Robenacoxib with small amount of food, not the whole daily portion, this is not okay, but the small amount of food, maybe, I don't know, how you call it, pasteta. Pasteta, no? You can give it with pasteta, no problem. It will work super, so that's not limitation. Just do not apply it with the whole daily portion of pellets, yeah? Those are dosaging, very easy to remember, and indications, yeah, osteoarthritis and surgery. So this is another option that is coming to your market, yeah. Box will look like this. This is Robenacoxib solution for injection, registered for cats and dogs for sure. 2 milliliters bottle. You will apply it under the skin. That's the way it is registered. 1 milliliter per 10 kilos. Very easy to remember, yeah. You can apply it up to 3 days in a row, which is also something that is, for example, different from carprofen, yeah, from meloxicam. You cannot repeat meloxicam injection; it's one time only. But with the Robenacoxib, you can reapply it, yeah. And already told you, with having 2 formulations, you can use it interchangeably if needed, yeah. And those are limitations with the age and weight, yeah. So this is also one option that is coming to your market. This is additional strength that is prepared exclusively for the cats, 6 milligram tablets. What is attractive in this tablet formulation? I know that cats are hard to peel. So this tablet is very small, 6 milliliters tablet. If you compare it with milprazole, for example, this tablet is smaller, yeah? And even milprazole is small, but Robenacoxib is even smaller. It is very compact tablet. It is basically smaller than usual typical cat kibble. Also in cat formulation we have 2 additional flavors, which is I heard that Monsieur is not present on your market, but Monsieur is having just 1 tasting element. We have 2, so yeast and meat flavor. This will be indication quite similar, so surgery and chronic and also acute disorders. Once per day applications, just the same like you are having dog tablet. And with cat, it is already written in the SMPC that you can give it with a small amount of food. Basically, in cat, it is different. You can give it with 1/3 of daily portion of food. So, slightly different than dog formulation. So, just to conclude, where I see Robenacoxib, Robenacoxib the most useful choice. Cats, for sure. For cats, you do not have a lot of options, and meloxicam for sure is not the best option for especially senior cats because therapeutic margins are narrow. So for sure, Robenacoxib is better option. Then, yeah, perioperative pain. For sure, why is this good option? Because the effect is quick. Which is good because pain is very present when we do the surgery. Then for sure senior pets, I'm sure you have quite a big population of those also. Basically, the data that I could find is that 1/3 of dogs and cats in Europe are older ones, so older than 7 years. So this for sure is a good population for Robenacoxib. And I already mentioned you when you will decide for long non-steroidal therapy, for sure safety features and no accumulation is the thing that you will decide for Robenacoxib. My dog is also in this category, so I can tell you by heart that I'm really satisfied with the results. Yeah. So, thank you for your time, means a lot. I know that you are super busy and that you take your time to listen to me means really a lot to me, so thank you.